Come in.
Good afternoon.
Hi.
How are you today?
I'm good. I'm Brianna.
I'm Nicole. It's nice to meet
meet you.
you. So do you prefer by going by Brianna, or would you like me to call you by your last name?
Brianna's fine.
Brianna? Okay. All right, Brianna. Today I have a few questions for you about your hair, skin, and nails. Before we get started, do you have any questions for me?
Nope.
Okay. So to get into it, do you have any past history of skin disease or any skin problems?
No. Well, I have eczema.
You have eczema? Okay. How do you currently treat it?
I just use lotions.
You just-
Unscented lotions.
Unscented lotions. Do you have a family history of allergies or any skin allergies?
My mom and most of the women on her side of the family have eczema.
Okay. All right. Let's see. Is it associated with any drugs or plants or animals?
No.
No? Okay. And do you have any birthmarks or tattoos?
No.
Okay. Do you notice any change in your skin pigmentation at all?
No. I mean, I've gotten a little paler.
A little paler.
Since moving up here.
Oh, yeah, that'll happen. Definitely. Do you have any moles or any birthmarks or anything like that?
I have a mole over here, and I have a few sprinkled on my arms.
Okay. And do you notice any color, size, shape, or any different change in that? Okay. So you said you have eczema. Do you have any excessive dryness or moisture associated with that?
Excessive dryness.
Excessive dryness?
Yeah, it gets really red and kind of just painful.
Okay.
Cracked.
Gotcha. And does it change the feel of your skin? You said it's dry, so is it kind of like
That feels more just like a lot of cracks, kind of like sandpaper almost.
sandpaper? And is this a seasonal issue, or does it happen all year round?
It mostly just happens during the winter time when it gets just really cold.
Really cold? Okay. So you have eczema. It's associated with itching. Am I correct?
A little bit. Sometimes it is more just the painful side of eczema rather than
It's
itching.
painful. Okay. Is it mild or intense pain?
The pain is very intense.
It's intense?
Mm-hmm.
Okay. And just maybe mild itching with that?
Yes.
Okay. And does this does it awaken you from sleep?
It actually keeps me awake.
Oh, it keeps you
So
awake.
before I fall asleep, it's really, really bad sometimes after I put something on to kind of help it, like maybe lotion or a cream.
Mhm.
It turns kind of like bright red, and it feels like it heats up, and it just feels like it's a painful burning sensation. So I'll just put my hands down and I'll let them cool off or try and blow on them because
Okay.
it kind of helps.
And where does this itching start? It just starts on your hands?
Usually it's just across the knuckles.
Across your knuckles? And does it spread anywhere else? Okay. Do you have any other skin pain or soreness?
No, that's just the only area.
That's the only area? Okay. Do you have any excessive bruising anywhere?
Mm-mm.
Okay, no bruising. And with your eczema, when do you notice it coming on? Is there anything that brings it on specifically?
If I do a lot of washing with water or dishes or things like that, I notice that the water definitely brings on the dryness quickly.
Okay. And you said it's on your hands,
Mhm.
and it doesn't spread anywhere.
Mm-mm.
And then, can you describe you said it's intense, so any other characters or qualities that are associated with it?
It just feels like it's burning, and it's just
Burning.
heat, kind of almost like heat's radiating off. Like if I put the top of my hand on my top of my hand over here, I feel the
You
heat.
can feel the heat.
Mhm.
Okay. And then the duration. How long does it usually last?
Like the heat.
Just the eczema in general. First of all, how long does that last?
It can just last the whole winter.
Whole winter.
Mhm.
And then when you do have that really bad heat issue, how long does that usually last?
It probably just lasts maybe 10 minutes.
10
And
minutes.
then it goes away.
Okay.
That's usually just if I put stuff on it.
Okay. And do you have any other alleviating or do you have any alleviating factors that help calm it down or make it at least bearable?
I like to maybe put some kind of cold compress on it.
Cold
It feels,
compress?
yeah, that helps it feel a little bit better. Other than that, it would just be the lotion.
Just
And
lotion.
that depends.
And then any aggravating factors other than the dry winter?
Warm or hot water, it really, really hurts. Water in general, but warm and hot water, it's painful.
Okay. And then do you have any medications, which are prescription or over-the-counter, that you take?
Not right now. I used to have a prescription. I can't remember what it was, but I put it on once and it brought on that painful burning sensation.
Did.
So
And was it topical or a...
it was a topical ointment.
Okay.
I just can't remember what it was called.
And I just have a few more questions for you. Do you have any changes in your nails?
No.
Such as like the shape or color or brittleness?
Mm-mm.
Okay. And do you chew or bite your nails?
I bite my nails occasionally.
You do?
It's the stress.
It's the stress? Okay. And last question is, what do you do to care for your skin, hair, and nails?
I shampoo and condition my hair.
Okay.
Do some lotion, unscented lotion.
Unscented lotion?
That's about it. I really don't use anything else for my skin
Okay.
or my hair.
Okay. So those are all the questions I have for you. Do you have anything to ask me before we end the session?
No, I think you've answered a lot of questions and kind of helped.
Okay, great. Well, it was really nice meeting you.
It's really nice meeting you. I hope to see you again.
You too.